despite all the advances and all the new therapy options, we are still not able to cure multiple sclerosis. Essentially, multiple sclerosis remains a relatively progressive disease. And what we have achieved in the past 20 years is treating the disease in its early stage, where we have more inflammatory component, with the hope of minimizing disability in the longer term. But we are not still able to cure it. The reason for not finding a cure could be many, but also the difficulty in understanding the disease process, which has both an inflammatory and neurodegenerative component. I think a lot of emphasis will be there in the next few years trying to reduce the risk of the disease by modifying diet. There is a lot of discussion about gut biome and its potential role, but we all know that maintaining high level of vitamin D levels in the physiological range, of course, avoiding saturated fats, perhaps high salt diet, and of course, not smoking would be important steps to reduce the risk of multiple sclerosis. Maintaining a healthy weight, I think, is also important, and avoiding saturated fats. I think we have to emphasize lifestyle issues to the younger generation, because we often do not cover those topics as part of our consultations in the clinic. In the longer term, whether there could be a magic cure or whether there would be a potential combination therapy addressing the inflammatory and degenerative component of the disease to halt the progression remains to be seen.